tumekubaliana.
Na mtazamaji, unaendelea kutazama taarifa za mbiu ya KTN alasiri hii. Moja kwa moja na kupeleka katika kaunti ya Mombasa ambako waziri wa afya Mutahi Kagwe anahutubia vyombo vya habari kuhusiana na tathmini ya virusi ama msambao wa virusi vya corona. Hebu tusikize.
Between the two levels of government has enabled us to manage the pandemic very well so far. For this, I want to thank each one of you for the role you have so far played and continue to play to save the lives of our people. It must not be lost on us that there are certain counties that have really heightened the level of preparedness to deal with the pandemic. If you may recall, His Excellency the President did direct that all 47 counties must ensure that they have a 300-bed capacity. Most counties have attained this, with some even doing better and surpassing this target. But there are others that have not. My plea to you as the drivers of health in your counties, particularly those who have not attained this target, is that you deal with this matter as expeditiously as you can, particularly at this time when we can see what is going on around us. Please, please, do not let your county down. I'm equally aware of the challenges this pandemic has brought to us, starting with laboratory testing, personal protective equipment for healthcare workers, the challenges at KEMSA, especially availing the same at reduced prices, and citizen responsibility, among others. Even as we move to address these challenges, we must remain focused on the bigger picture of providing efficient and affordable health services to our people. This morning, when I met with the other forum, the County Government's Forum, one of the discussions that we did have is to ask ourselves as leaders, what really is our job? What is my job as a health minister in this country? And it boils down to a very simple sentence. It is to put a smile on a patient's face. That's my job. It doesn't matter what else we do. It doesn't matter how many forums we hold. It doesn't matter how many meetings we have. It doesn't matter how many brick and mortar buildings that we put up in our counties. It doesn't matter how beautiful the building is. It doesn't matter how qualified we are, because you can be very qualified, but you still don't put a smile on a patient's face. That's our job. Our job is to put a smile on the face of a patient. The vehicles we drive, the offices we have, the journeys we make to Mombasa and Kilifi and elsewhere, those journeys are a means to an end. They are supposed to create a circumstance around which we can put a smile on the patient of a patient in Kenya. And if patients walk away annoyed because they couldn't afford it, because the doctor did not treat them well, because the nurse was abusive, all those things are happening, we are failing in our jobs. We are not doing our job. That's what Kenyans pay us for. That is what Kenyans pay us to do. So colleagues, and this is particularly the case with other diseases that we face as well besides COVID. With cancer, for instance, where we lose up to 70% of our patients because they are diagnosed in stage 3 and stage 4 when treatment options are minimal and collectively. In this room, we, you and I, and the practitioners we oversee, hold the answer to the challenges bedeviling our health sector. And the changes that we want, the changes our loved ones want to experience when they seek medical care, must start with us. This weekend, we must re-energize mentally and commit ourselves to this noble task that we have been given by both man and God. Just to remind you, the responsibility at the Ministry of Health in the national government is to establish policy, develop practice guidelines, manage training, and generally oversee the sector. As for you in the county governments, your responsibility is to deliver services to our people. It is you that Kenyans interface with when they walk into our county hospitals. It's the impact of your work that they feel. It's your service that touches them. Therefore, when a mother watches her newborn baby take its first breath and hears its first cry after she has had a normal delivery, those are the memories she will forever cherish and associate with the facility. But when her experience is one of anguish, one of abuse from healthcare workers, even though she might candle her child after, her memories will forever be tarnished, and her impression of government and medical care scarred. County hospitals represent the facilities most frequented by Kenyans, and I know, having grown up going to district hospitals, that this experience can also be a very pleasant one where a patient feels safe and comforted. I am sure you can relate to this. Why? Because if you are like me, or like most Kenyans, and you had a choice, you wouldn't visit a private hospital if the government hospital was a good one. You'd go to the government hospital. And talking about experiences and what one remembers, let me give you a personal experience and what I remember. Years ago, I had a toothache. When I was a young man, I had a toothache. I was taken to a hospital in Mukurweini constituency. There was no anesthesia. And indeed, I don't think there was a dentist in the room. However, somebody had to deal with my tooth. And what they did is that they just got a pair of pliers. You know, as if they are on a construction site. And I was told to open my mouth. And at the sight of a pair of pliers and no dentist at hand, and the guy telling me to open my mouth is a guy I knew. And it was quite clear to me he has never been in any medical facility. At which point I took off and ran away. That is what I remember about that hospital to this day. If you tell me about that hospital, I remember my plight and my running away with my aching tooth. In fact, to conclude the story, I went and tied a string to the tooth and pulled against a pole and removed it. But anyway, that is my experience. Don't give anybody, any young man, any young girl, anybody, an experience like that one. That hospital did not put a smile on my face. That health worker did not put a smile on my face. I don't remember them fondly. You don't want to be remembered the way I remember them. And this is what I'm saying. We, the people of Kenya, have something very special that we seldom take time to appreciate. As the COVID-19 pandemic illustrated, we have the capacity to adapt quickly to changing situations, to innovate when prompted to, from a health perspective, to rise up and to be counted. This nation boasts thousands of doctors, boasts of thousands of doctors, nurses, and other healthcare providers who go above and beyond their everyday calling for their patients. And when they just don't do so, in the spirit but also with skills and expertise, we in the public sector have the capacity to rival any private medical facility. We can do it, and yet we are not quite doing it. The Kenyan families that spend in excess of 8 billion shillings annually seeking treatment abroad in India, Dubai, South Africa, largely for cancer and other ailments. They are our friends and relatives. In fact, you and I are the ones who go fundraising for them, even though we know that we will welcome a majority of them back for burials. At the national government, we are clear about one thing: this situation is not tenable and that it requires radical surgery. Beyond making institutional changes, we have also commenced a process that will elevate our diagnostic capacity, modernize our hospitals, integrate us globally through digital platforms, and more importantly, offer our medical professionals better opportunities. We have already established for the country and region the first imaging molecular center, which will be housed at the Kenyatta University Teaching, Research and Referral Hospital. It will soon give us the capacity to produce isotopes for all counties, should they equip their facilities with the other diagnostic equipment that are required to take advantage of the isotopes. And just last week, when I was in Rome, Italy, where I met with numerous groups that are keen to collaborate with Kenya in the strengthening of our medical sector post-19 pandemic. And at this point, I would also like to say that we have a team now that is co-chaired by the Chair Committee, Council of Governors for Health, Governor Kuti, and the KU Chair, Olive Mugenda. They have formed a team, a task force, that is supposed to work on the issues of cancer and the implementation, a special purpose vehicle, whose responsibility is to follow the implementation and the purchase of PET scans to various regional hospitals in order for us to be able to carry out cancer treatment from diagnosing a full range all the way to treatment. Now, this is the first time this is happening in this part of the world, and we should be proud of it. Further, His Excellency the President indicated that the county governments will only finance half of that special purpose vehicle issue, with the national government providing the other half of the money. And it will be on first come, first served basis. So those counties, the regional ones we have identified as cancer centers, the ones that finish their issues and the ones that can conclude this matter first, are the ones who are going to get the first money available. And I think it is only fair and right that this be the case. Therefore, let us seize this opportunity we have at hand. When we collectively perform better, we not only enhance the experience of our people at our facilities and deter them from seeking treatment elsewhere, but we make them our advocates. Advertisers who in turn attract the local investor, will hire our unemployed healthcare professionals and boost our county hospitals through the provision of imaging and diagnostic equipment. And since many present here are also doctors, let's focus on improving the accuracy of our examination, because I am sure you'll agree with me that one of our most costly mistakes stems from inaccurate diagnosis, which results in wrong prescriptions and unfortunate consequences. As service providers, yours is a critical duty of ensuring that we get our process right. And ours is a responsibility of ensuring that we support you through systems, legislation, and provision of commodities. To enable us to do our job, you must do yours first, and in good time, so that we can be facilitative. In short, we must work together. It is the key to the success of healthcare in Kenya. Whether you brand it as UHC, or whether you just say it is just taking care of a patient, the success, or otherwise, lies with the cooperation that you and I make. Colleagues, ladies and gentlemen, I would like to conclude on the note that I started with, the reason why we are here. 2 years ago, His Excellency the President Kenyatta launched a pilot phase of universal health coverage with the intention of triggering our understanding of what was practical for us in our delivery of superior health services to our people. The pilot was undertaken in Kisumu, Isiolo, Machakos, and Nyeri, with each of these counties being picked as a representative of others with similar challenges. I want to thank the leadership in those counties for their participation in the pilot program. From their experiences, we now have the meaningful takeaways that will now benefit the others, even as the ongoing discussions between the Ministry of Health officials and county executive committee members of health and their officials iron out the issues of concern. Whereas I know there are a couple of issues, one of them requires mention: the signing of the Intergovernmental Participation Agreement. It's worth noting that without this agreement, the rollout of UHC will be in jeopardy. Yet, it's a promise that we have to deliver healthcare to Kenyans. The IPA framework, among other things, is supposed to define the roles and responsibilities of each of the participating parties. And I'm glad to hear that these were some of the issues that you have dealt with today. And as we move forward, I am also certain by the time we finalize with the governors, we are going to have a very good agreement. As I have said severally, the promise of UHC is anchored in the delivery of a better service experience for Kenyans. Universal health care is not an end in unto itself, but is rather a means to a better, healthier, and I dare say, happier society. We who have gathered here today have the key to our people's healthier lives. Our commitment to the success of UHC is therefore very important, whether it's through the identification of the very poor in society for enrollment in the NHIF scheme, or whether it is via mobilization of those able to enroll in NHIF, or in ensuring the IPA framework is established and successfully followed. Let us all work to resolve whether issues there may be with speed and deliver the promise of UHC to our people. Let us challenge ourselves to make sure that our people visit our facilities and live, as I have repeated, with a smile, aware that they got their problem clearly diagnosed, got the right prescription, and that the service was quick, efficient, and affordable. Let us create a healthcare system that will not only serve local and regional interests, but also develop one that is of an international repute and respect. I have been told that health is a challenge across the world. As you know, you have all read, discussed, observed the politics above Obamacare in the United States of America. And other countries have got similar challenges. To arrive at the system that we have, members of the Ministry of Health traveled across the world looking at what others are doing in Thailand, in Asia, in Europe. We have looked at the systems that exist there. And there are those naysayers who will believe that it cannot be perfected here in Africa or here in Kenya. But they have said that before. And we have proved them wrong in other areas that we have been championed, in other spheres of life that we have championed, including ICT and others, where we have challenged and beaten others much better endowed in terms of the facilities, in terms of resources. All we need to do is stay determined and stay the course. Healthcare is such a personal experience. It couldn't get more personal than your body and your illness and how you feel. Besides, when you do what you have to do, when you work so hard, and I know most of you do that, it is enlightened self-interest. And why do I say that? Take, for example, the current situation of COVID-19. As you know very well, the few private sector hospitals that we have are already stretched out. It is not an indication that the country's health facilities are stretched out. It is an indication that the faith that we have in our own government sector is wanting. But remember one thing, as the CEC of health in your own county, if today you got unwell, God forbid, or you had COVID-19, God forbid, or a family member of yours had the attack, the virus, God forbid, I want you to remember that you would have to take them to that hospital which you have helped build, which you have helped facilitate, which you have helped organize, because there is nowhere else for them to go. There is nowhere else for you to go. You can only go to the facilities that you are helping establish and work on. You don't have a choice. You can't even leave the country, because where are you going? India is packed. The United States is packed. Italy is packed. France is packed. Where are you going? You have nowhere else to go. So it is basic, enlightened self-interest for you to ensure that the facilities in your counties are top of the range. And on my part, we are here as a Ministry of Health to ensure that what you are determined in succeeding, we will assist in. And in this respect, we also need to think very carefully about how NHIF is going to work, and we need to support the mandatory health insurance for all, make investments in primary health care, identify our human resources for health needs, and put in place mechanisms for addressing these, and finally, make the appropriate investments in the provision of affordable health care. I think one of the things that hopefully we can also come out with here today, at least by the end of Saturday, is just how to bring down the cost of health care in Kenya. We have to address this particular issue. NHIF has got to set the limits for each activity that happens in the country. You cannot have a situation where an X-ray costs 800 shillings or 600 shillings at Kenyatta National Hospital, 10,000 shillings in a private hospital, and NHIF pays both. That cannot and will not continue. If they are paying 800 shillings at Kenyatta National Hospital, then they can only pay 800 shillings at Aga Khan, and they can only pay 800 shillings at Nairobi Hospital or any other private hospital. Because only then can we be able to bring down the premiums at NHIF and then spread them across all the people in this country who can't afford it. That's our job. Ladies and gentlemen, that's our job, to bring down the cost of healthcare. If we bring down the cost of healthcare substantially, that is the only time we can then call ourselves a healthcare tourism destination. We must peg on ourselves on a simple equation. Our cost of healthcare must be equal to or less than India. Simple. Equal to, you remember those of you who are mathematicians, equal to or less than India, Kwisha. And if we do that, we will be able to benefit our doctors on the basis of volume of work that will come from the region, so that we operate a pricing strategy that is called a volume strategy, a mass strategy, pricing strategy, rather than a scheme the cream strategy, where you want to buy a house on the basis of scheming from one client. It is better to take 1,000 people and buy a house with that 1,000 people, rather than only 2 clients. Then a lot of people can come for healthcare, and doctors will benefit, and nurses will benefit from this by getting a lot more people to treat. So even as we deliberate on the scale-up of UHC, let us not forget that we are still in the midst of a pandemic, and we have a duty to inform our people on the status that is going on. As you have noticed, the number of positive cases, hospitalized, and fatalities have gone up. We are essentially in some sort of second wave of the virus infections in our country. On the first wave, the highest positivity rate, round about July, was about 13% positivity rate. The day before yesterday, we had a positivity rate of 20.2%. Yesterday, we were at 15%. Today, we are once again at 15%. This is from a low of about 4% average per week in the month of September. Clearly, we have an issue to deal with. Up until yesterday, we have lost 54 lives to the disease this week alone. And I'm sad to report that today, once again, we have lost another 14 patients. This brings our cumulative fatality to 964 persons. In addition, there are some 1,084 patients admitted in our health facilities. At the same time, 35 patients are in the intensive care unit, out of whom 14 are on supplementary oxygen and 18 on ventilatory support. We also have 40 patients who are separately just on supplementary oxygen and not in the ICU. And another 24 patients are in the high dependency units. Some 761 people have tested positive for the virus today, from a sample size of 4,830 tested in the last 24 hours. We now therefore have 52,612 confirmed cases in the country, and we have tested some 678,000 people in the country. So we know that we have a second wave of this disease. And the balance between keeping our economy running and keeping people safe is one that is obviously creating its own challenges. And I want to just state that there are fundamental changes, whether in case management or in our behavior, that we might have to require our people to make. Following the meeting with the governors tomorrow and the summit, and the governors' summit with the president on Wednesday next week, we will be able to give direction to the country. But there is one thing that I would like to state as a philosophy and a policy, that going forward, the advice we have got from case management teams in the Ministry of Health is that the key fundamental management center is going to be home-based care. Let me make this clear, that individuals who do not have the symptoms of are not symptomatic should no longer be necessarily locked in hospitals. Families, with the support of community health workers, must begin to learn how to manage positive people who are not sick, so to speak. There is no reason for us to hospitalize an individual who shows no sign of any sickness except that there are positive cases. The experience we have had is that those people being managed at home get well much faster, very quickly, than those ones who are hospitalized. We have also known and witnessed cases where individuals are contaminated by other infections in hospitals and then pass away because of something else, even though they were taken to hospital because of COVID-19. Therefore, going forward, and this will be elaborated better with clear protocols, going forward, I think it is better for the country to know that the main method of containment and managing this disease is going to be home-based care. What does this mean? This means that as an individual, as a person, if you expose yourself or if you treat yourself carelessly, you must understand that the people who are going to take care of you are your own family members. I think it is therefore advisable for you to wear your mask, for you to keep your distance, for you to avoid places where you know that you can get the virus. It is now a family responsibility. Each family member must protect the other family member. Because if one of you gets the virus, and provided that you are not sick, it is the other people within the family who have to take care of you. Now this means that all the family members are going to leave you in your room, possibly give you your things, your soap, the items that you require. It means that family members might have to move around beds to leave you alone in your room. It means some family members might have to go and stay with an auntie so that they can create a room for you, etc. You are going to inconvenience. You are going to inconvenience people in your family. And that makes that much more important for us to take care of ourselves. And the reason why this is going to be the case in any event is there is a limit to how much and how many beds we can keep on creating in the country. And therefore, it is good for the country to understand and Kenyans to know that we are doing everything possible that we can, but we have to evolve with our knowledge. We are not where we were in March. We are smarter, we know what to do, we know how to take care of people, we know how to manage the patients, we know case management better. Our doctors are smarter in this than they were at the time that we got the disease, and therefore, it is important for us to understand how we are going to proceed going forward. It is still clear that the spread of the disease is largely from areas where people are crowding, especially in entertainment areas, especially the places that are indoors. When you go to, if you must go to an Italy, and if you must go to have a caspeccio, go outside. Try and do it outside. Don't go into a little room where people are virtually whispering to each other. And the biggest distance between them is a couple of inches between the mouth and the ear. Don't go there. Stay away. If you have to go somewhere, go someplace where you'll be sitting outside. You are better off. So because looking at these grim statistics, it's obvious that something has certainly gone amiss, and it behoves us as a ministry to say it. We certainly seem to have dropped our guard on matters containment. And I have said over and over again that when we treat this disease normally, I need not finish that, it will treat us very abnormally. The first responsibility for containment is the individual. And it's important that people realize that when failure to adhere to the laid down protocols could very well lead to an escalation of the measures that we have made. Containment is not a matter for the government alone, not at the national or county levels. It's a matter that every individual must adhere to. We have to remain disciplined and focused on social distancing, wearing masks, and all the other measures that I'm sure are already known to Kenyans. I encourage you, my fellow colleagues, mawaziri wenzangu, I encourage you to mobilize your community leaders, mashinani, to ensure that all adhere to these measures. let not this message be only coming from the national government. Let this message also come from you in your own counties. Because if we work together, we can stem this light. We can do it. And let me also remind Kenyans that even though the application and enforcement has largely been not there, let me remind fellow Kenyans that wearing a mask during this period, and in accordance with the health protocols that we have issued, and in accordance with the Public Health Act, that not wearing a mask can render you fined a substantial amount of money. Now there are those who will say that once we start implementing this, fining people who are not wearing masks, and people have said this to me, that if we start this fining, then all we will be doing is that the police, our enforcement agencies, are going to start demanding that you give them something so that they don't take you to court. I challenge you. I want to see the day when, even when you are wearing a mask, a policeman will ask you for something, TKK. I want to challenge you. So if you have to pay, then, if you want to bribe somebody because you don't have a mask, surely, is that the CEC's responsibility? Is that a responsibility for the CEC? It is not. Is it my responsibility? I don't think so. It's squarely your responsibility. And you're parting away with that money is something that will be painful. So why go through that? Why don't we all just say, in order for us to keep the economy going, in order for us to keep these jobs going, why don't we just agree as Kenyans that, please, let me save my brother's job, let me save my sister's job, and if wearing a mask and keeping a distance is what is going to make my auntie pay school fees for her children because she has been kept working, why then wouldn't I do it? Why wouldn't I do it? When I don't wear a mask, I threaten my children, especially now that the children will have to take care of you when you are in your house. I threaten the job of my brother, because if it goes too much, we have to bring serious containment measures, which will then mean that Kenyans are out of jobs. A very painful decision to make. So we shouldn't expose ourselves to that situation. I urge you, as leaders in the counties, please put together a team, an infrastructure that ensures that this is done. And as we do so, and as I finalize, I also want to, I know that DG has been talking about the issue of how to bring this data together. And I don't know, DG, whether you had a chance to discuss that issue. Because CECs in each county should be the focal point of what is happening as far as COVID is concerned, or other diseases are concerned. You should set an infrastructure that on an hour basis, you are informed about what is happening in your county. Because very many times, we call the CEC, we are telling them about things that are happening in their counties, community deaths that are happening in your county, and a lot of you don't seem to be in the picture. And in that first respect, I want first of all to really commend and congratulate the CEC for this county, Hazel Koitaba, because she's really on top of it. If you call Hazel, and I know she's not here, if you call Hazel, she knows everything happening in this county about health instantly. And she's the one who will fast forward you information about what is going on. I urge you, please be efficient in terms of the information you get, and let us understand from every county, where does the buck stop in your county? Who do we ask the questions that the DG would want to know? Because we are reporting these things at a certain time during the day. Between 2:30 and 3, the media is waiting to know what is happening in the country. Therefore, by that time, it is important that the labs in your counties, the figures in your counties are already with us. And I think it is the CEC's office that should collect all this information and keep us posted. So I want to stop there, once again, to thank you sincerely, most sincerely from the bottom of my heart, and to mention to you that the launching of UHC is the start of a journey. Let's be clear, because there are those who will immediately start criticizing things that are not happening. And you'll be told it is a failure, it is not working, this is a baby. Most of you are in the health sector. We have a new baby. This baby is going to go through teething issues. Expect teething issues. Expect certain challenges to come. Expect new things to emerge, even as we implement it. But the point is, if we wait until a time when everything is perfect, we are never going to have UHC. So let us launch this thing on Saturday. Let's prepare ourselves. Let's move positively, believing that we need to give Kenyans good health care, and believing in yourself as a CEC responsible for your county, that you can execute it and you can succeed. I know you can. I know you can. You just need to believe that you can. Thank you very much. Are we taking any questions or we finish? Okay. From the media, I know that you might want to ask one or so questions. The media people, if you are, and I would like the DG to please join me in case they ask any technical question. I'm still not a doctor.